Hello, I'm Eleni Tsigas, Executive Director of the Preeclampsia Foundation, and I'm here today to tell you about how we're turning baby steps into giant leaps. As you know, it's our mission to reduce maternal and infant illness and death due to preeclampsia and other hypertensive disorders of pregnancy. We do this by raising public awareness, providing patient education and support, improving healthcare practices, and catalyzing research. We have come a long way since our beginning 15 years ago, and in 2014 we saw a lot of early baby steps turn into giant leaps. We owe our exceptionally qualified volunteer board of directors a special thanks for their leadership and commitment. They are leading us to the next level as the nation's only patient advocacy organization dedicated to preeclampsia. Our prestigious medical advisory board is second to none, with the brightest minds in preeclampsia from the nation's leading medical institutions. To all of our volunteers who are new to the foundation or have been with us every step of the way, thank you, thank you, thank you. In just 2014 alone, you volunteered more than 7,500 hours, which translates into the financial equivalent of nearly $174,000 in revenue back to our mission. And our volunteers walked the walk in a giant way. More than 4,600 of you participated in our 37 Promise Walk for Preeclampsia events last year, raising nearly $500,000 across the country. And what can I say about you, our donors? We simply couldn't progress without your support. Special thanks to our tribute gift donors who honored or remembered lives touched or taken by preeclampsia. In 2014, we hosted the 10th anniversary Saving Grace Legacy event. This event exemplifies just what can be accomplished through the efforts of dedicated and passionate volunteers and donors. Now, let's take a look at how we're turning baby steps into giant leaps in each of our mission areas.
Raising public awareness of preeclampsia is a key priority for the Preeclampsia Foundation. To determine the level of preeclampsia awareness, we conducted a nationwide survey of more than 1,500 expectant and new mothers with Baby Center, a top pregnancy and parenting online resource. The survey showed high overall awareness of preeclampsia, a far cry from where we were in 2008 when survey results showed less than 50% awareness. But the survey also showed that the majority of respondents didn't know the specific symptoms associated with preeclampsia, or that it can occur up to 6 weeks after the baby is delivered and lead to future health problems. Based on these findings, the 2014 National Preeclampsia Awareness Month education campaign used the theme Take the Preeclampsia Pledge, Know the Symptoms, Spread the Word. Our campaign partners included many important and influential health organizations. The campaign introduced an animated video called 7 Symptoms Every Pregnant Woman Should Know. Available in English and Spanish, this easy-to-understand video has been viewed nearly 90,000 times since and continues to be shared. We also made giant leaps in 2014 in our second mission area, providing patient education and support. To make sure we fully understand and represent the multitude of patient experiences related to preeclampsia, the Foundation launched a Patient Advisory Council last year. The Council serves as an advisory resource to the organization's board of directors and staff, and furthers the Foundation's position as a patient-centered advocacy organization. As the Foundation's primary source of public information, our website was made more mobile responsive to enhance the user experience. And we launched an all-new Spanish website for our Hispanic friends. Social media continued to help us get the word out, and the number of our Facebook likes and Twitter followers increased every month. Our patient education efforts also included the distribution of informational brochures, DVDs, magnets, symptom pads, and illustrated tear pads to the tune of nearly 400,000 pieces. Now let's talk about our third mission area, where baby steps are turning into giant leaps, improving healthcare practices. The California Maternal Quality Care Collaborative adopted our illustrative symptoms tear pad into its preeclampsia toolkit and distributed it to hundreds of hospitals in the state and across the nation. By knowing the symptoms, pregnant women are more likely to seek medical attention right away if they experience any of them, and that can save lives. Another major practice improvement in 2014 The American Heart Association introduced the first ever guidelines for preventing stroke in women with a history of preeclampsia. Thanks to our advocacy work around its long-term health impact, these guidelines included preeclampsia as a risk factor for heart disease and stroke. Speaking of preeclampsia's impact on heart health, we were awarded funding last year together with Boston's Brigham and Women's Hospital for a study called Heart Health for Moms, engaging women with a history of preeclampsia to reduce their risk for cardiovascular disease. The Heart Health for Moms program is the first of its kind, designed specifically to inform women with recent preeclampsia about their heart risk and help them make lifestyle changes. Last but certainly not least, let's look at our fourth mission area accomplishments in 2014, catalyzing research. We partnered with the International Society for the Study of Hypertension in Pregnancy to launch the Empower program to create and support partnerships between seasoned mentors and young investigators to improve research capacity in low-resource countries. The Foundation also awarded $25,000 vision grants to Dr. Erica Hammer and Dr. Terry Morgan for their preeclampsia research projects here in the U.S. And we were on the receiving end of a $30,000 medical research grant from the Community Foundation for Brevard. To develop a potential cure, this medical research project expanded the preeclampsia registry to include a biobank used to study the genetics of preeclampsia and its impact on the health of mothers and infants. Celebrating its first anniversary in 2014, the Preeclampsia Registry achieved an important milestone by being accepted into the Global Pregnancy Collaboratory and enrolling 1,400 participants in its first year. Now let's go back to Executive Director Eleni Sigis for some final words.
As you can see, we are very proud of the giant leaps we're making in our quest for a world where preeclampsia no longer threatens lives. On behalf of the Preeclampsia Foundation, I thank you for your attention and everything you do as we work together to save the lives of mothers and babies everywhere.